Welcome back to Med Madness Podcast. Today, we're diving into an important topic, managing migraines during pregnancy. Headaches are a common issue faced by many pregnant women, but fortunately, most are benign. However, when headaches present with atypical features or occur in women beyond 20 weeks of gestation, it becomes crucial to evaluate and rule out other potential causes such as preeclampsia or cerebral venous thrombosis. These conditions pose significant risks, including stroke and disseminated intravascular coagulation for the mother, and growth restriction or even demise for the fetus. In today's discussion, let's focus on the typical migraine without aura, a throbbing unilateral headache that can significantly impact quality of life. Managing migraines in pregnancy presents unique challenges due to limited therapeutic options. Our goal is to navigate these safely and effectively. We start with non-pharmacologic therapies, which can often provide substantial relief. Encouraging rest, staying well hydrated, and applying heat can be beneficial. Acetaminophen, commonly known as Tylenol, is our go-to first-line option. It's considered safe and effective for pain relief in pregnant women. Alongside acetaminophen, simple measures like reducing exposure to light and sound by resting in a dark room and consuming caffeine in moderation can help alleviate symptoms. Next, let's discuss what happens if acetaminophen alone doesn't suffice. We can consider second-line treatments. Combining acetaminophen with antiemetics such as promethazine or using a low-potency opioid like acetaminophen codeine can be beneficial. Additionally, medications containing caffeine and butyl might offer the necessary relief. For acute scenarios, parenteral antiemetics like metoclopramide can be very effective as a monotherapy. When these options fail to provide adequate relief, we move to third-line treatments. Non-steroidal anti-inflammatory drugs, NSAIDs, such as naproxen, can be considered, but only in the second trimester. It's important to avoid these drugs in the first and third trimesters due to the risks they pose, such as spontaneous abortion and premature closure of the ductus arteriosus. In rare and severe cases where other treatments are ineffective, more potent opioids like oxycodone might be used, though we generally avoid these due to their tendency to worsen gastrointestinal symptoms like constipation and nausea in pregnant women. There are, however, certain medications we must steer clear of during pregnancy. Ergotamine, although effective for migraines, is contraindicated because it can cause hypertonic uterine contractions and vasoconstriction, leading to preterm labor and fetal growth restriction. Similarly, triptans, such as sumatriptan, are typically avoided due to risks of uteroplacental vasoconstriction, increased uterotonic activity, preterm delivery, and low birth weight. To summarize, our first line of defense against migraines during pregnancy is acetaminophen. When this isn't enough, we can consider combining it with antiemetics, low-potency opioids, or caffeine/butyl. NSAIDs can be used cautiously during the second trimester, but potent opioids are a last resort. Avoiding ergotamine and triptans is essential to ensure the safety of both mother and fetus. Let's bring this discussion to life with a real-life case study. Imagine Sarah, a 28-year-old woman, 24 weeks pregnant, who presents with a throbbing unilateral headache. She's been experiencing these headaches intermittently, but recently they've become more severe. After a thorough evaluation to rule out preeclampsia and other potential causes, her diagnosis is a typical migraine without aura. Sarah initially tries non-pharmacologic measures, resting in a dark room, staying hydrated, and using a warm compress. When these don't fully alleviate her symptoms, she turns to acetaminophen, which provides some relief, but not enough. Following her doctor's advice, she adds promethazine to her regimen and finally finds significant relief. Sarah's case exemplifies the thoughtful, stepwise approach needed in managing migraines during pregnancy, prioritizing safety while effectively managing symptoms. That's it for today's episode on managing migraines in pregnancy. Remember, the right approach can make all the difference in ensuring both maternal and fetal well-being. If you have any questions or experiences you'd like to share, leave a comment below. We'd love to hear from you. Thanks for tuning in to Med Madness Podcast. Until next time, stay healthy and stay informed.